Working with Dr. Roose is the most wonderful experience. I've learned so much from him just over a 2-year span that I don't think I could have learned from any other doctor.
He's definitely a role model to me, definitely someone that I aspire to be like.
Ever since I've known him, I've never seen him have a bad day. I mean, he's always energetic, and he's always happy. He always has a smile.
I feel like he helps us all to be better for the patient. He really helps us to keep in mind that we're here and it's really focused on what's best for them.
Our first Mother Superior, Mother Mary of Providence, had a wonderful saying: never rest on what's already been done, but always press forward to what yet needs to be accomplished. And so in this era, when drug addiction, opioid addiction is such a scourge on our people, our communities, our families, something needs to be done. And the pride I take is that Dr. Roose is committed to that. He sees the value in turning the lives of people around.
It almost makes you tearful, in the way that he speaks to them, speaks with patients, and really, you can tell that he's not distracted. He's not there for any other motive other than he just really cares about this person in front of him and really wants to do whatever he can to make any part of their life better and make them feel comfortable.
Typically when the patients are at the point where they're seeking treatment, they're at their lowest point in their lives, and they're really looking for help. And I think they see and meet him, and he's like the light at the end of the tunnel. He makes them feel like they deserve recovery. And I think for a lot of them, it's the first time that they've felt that.
I think one of the things that makes Dr. Roose special is his ability to work at a state level on the governor's task force and work at an administrative level, state level. He's here as a senior leader. He works in putting together an overall vision and structure for the program. And then on a day-to-day basis, he works with us as individuals on daily tasks and is able not only to be able to communicate, is flexible, it makes adjustments when needed. And then I think most importantly, he works with patients directly and is able to relate with them as well. And so, and he cares. He cares at all levels. He cares for people. He cares for whether it's a patient or an employee. He is present, and he takes extra effort to make sure everyone is doing well.
As soon as I met him, I thought, here's a kindred spirit. This man really, really gets it. He's rooted in it. He wants to make a difference, and he's willing to put the energy. A lot of people have the idea, like to do it, but they don't have the energy, they don't have the drive, they're not willing to make the commitment. And he's made the commitment. He's really driven the program. He has done everything in his power. You can never, there's nothing you can ask that man to do that he won't say yes to if it furthers the cause.
It's just his natural ability to connect with people. You can just tell that he genuinely cares when he meets a patient and they walk in the room. They just feel human again, when they maybe haven't felt like that for a long time.
Hey everybody, this is Massachusetts Governor Charlie Baker. I just want to congratulate Dr. Roose on receiving the Caritas Award. Doctor, you were part of our opioid task force. You folks blazed a trail for us here in the Commonwealth, which got picked up over time by about 46 other governors with respect to a strategy and a plan to deal with opioid addiction in their states. You've always been a leader in the space, even when it wasn't popular and people weren't paying attention to it. And your work at Mercy and your work across your career has been exemplary, and we are all better for it. I just want to say how much I appreciate your work here in the Commonwealth and the work of all the folks who are there with you tonight to join you as you accept this award. Addiction, as I've said many times, it is a disease, it's not a character flaw, and it's the kind of thing where we're finally getting to the point where people understand that. We've done much, there's much to do, and we're pleased to have you as part of our healing community. Congratulations and good luck.